Those who've had mild cases, obviously we are only 4 months into COVID-19 for the world. So we're still learning. There's still much we don't know. But it does appear that people who have had mild cases do recover fully and are able to continue with normal life. Those who've had bilateral pneumonia and have had the severe form of the disease, there is evidence to show that they have some degree of lung scarring and may continue to have symptoms related to that in the longer term. No, it's not. The evidence has clearly shown that it is droplet spread. That means that it is carried in tiny droplets from our respiratory tract, that is from our mouth or our nose as we cough or sneeze, or of course as we touch our mouth or nose and then take the the droplet spread particles from our mouth or nose and transmit them via our hands. So the reason that this has come up as a problem is because sometimes these droplets can be aerosolized. So that means as you cough or sneeze, or particularly in healthcare environments where you intubate a patient, put a tube into their throat or through their nose, those droplets become tiny particles that are unseen, and that's where the confusion has come in whether SARS-CoV-2 can be airborne. We don't know, we're only 4 months in. However, having a look at many pandemics through the centuries, of course this will burn itself out at some point. When it will burn itself out is the challenge. So generally pandemics burn themselves out when the susceptible population is too small to continue the wild virus circulating. So that either means that most people have had the disease and now have immunity, or they have been vaccinated and have immunity. And so there are fewer people around who have not been exposed to the disease at all, and therefore the virus or the disease burns itself out.